Every 66 seconds, a senior in America receives a diagnosis of dementia. By the moment this video concludes, 20 additional families will hear that statement. And for many, the explanation had nothing to do with advancing years. It originated from a container on their bathroom counter that they were assured was appropriate. I'm Dr. William Lee. During 15 years practicing medicine, I've witnessed this situation unfold repeatedly. Someone who possessed clarity their entire existence begins struggling to retain information. Forgotten names, overlooked appointments, the familiar route they've traveled countless times suddenly feels unknown. Everyone surrounding them attributes it to getting older. They were mistaken. A prescription was responsible, one hardly anyone questions because a medical professional ordered it and the pharmacy dispensed it. Current research consistently demonstrates something troubling. One every day, typical drug classification can significantly impair your memory and learning capacity within months. Yet most individuals using these medications remain unaware this is occurring. Over the next portion, I'm showing you 9 medications with the strongest connections to rapid memory decline. I'm ranking them from the overlooked culprits to what I consider the most harmful overall. Pay special attention to number 3. It's distributed to countless older adults for something appearing completely benign, and it might be damaging your brain's memory centers right now with absolutely no warning symptoms. Everything we're examining today, how certain treatments can affect your memory and thinking, this is exactly what my patients talk about all the time. I compiled the health guidance I share with my own patients and developed one practical approach for maintaining vitality and independence after 60. It addresses 28 significant health transitions that accompany aging, heart function, glucose management, mental sharpness, physical stability, and many more beyond that. Thousands have already found it valuable, and it's helped many of them maintain control over their health and live fully past 60. The link is in the description below and the comment I've pinned so you can access it whenever you need it. Before we begin, share in the comments how many years you've lived and which medications you're currently taking regularly. I review these responses, and your age information helps direct my upcoming content. Let's start with position 9. Don't dismiss this lower-ranking placement because this medication sits in practically every household medicine cabinet across America. Position 9 is diphenhydramine. Most recognize it by the commercial name Benadryl. It's the little pink capsule individuals grab for sleep support, allergy management, or cold symptom relief. The price is minimal. It's available without a prescription. Most assume that since purchasing it requires no doctor's order, it must be harmless. Within your brain, something notably different occurs. Diphenhydramine belongs to a medication family called anticholinergics. That complicated term describes something straightforward. These drugs inhibit acetylcholine, a neurological messenger. Acetylcholine helps your brain form fresh memories and maintain alertness throughout your day. Your brain generates progressively less of it as you get older and depends increasingly on whatever remains. So when a medication suppresses it, the effect on a 70-year-old brain differs dramatically from its impact on a younger person. The hippocampus takes the biggest hit, that small structure resembling a seahorse that generates new memories before transferring them elsewhere. Throughout my career, I've observed patients take an evening antihistamine habitually for years and incrementally lose their mental quickness, never recognizing that the pink tablet on their nightstand created the mental fog. Scientific findings make this association explicit. A 2023 investigation in the Journal of Geriatric Cognitive Health examined mature adults regularly taking anticholinergic drugs and documented a 54% increased probability of dementia development compared to non-users. That's more than 50% additional risk from a medication most individuals regard as harmless. The course of action is straightforward. Examine every container of anything you consume for sleep and anything labeled nighttime or allergy, because these products frequently contain diphenhydramine with alternative branding. When using it for allergies, newer options, including loratadine, available as Claritin, remain within your body without crossing into your brain tissue the way diphenhydramine does and present considerably less long-term risk. Never discontinue any medication independently. Bring this conversation to your healthcare provider. But stop accepting that non-prescription equals risk-free for your cognitive health. That concludes position 9. Position 8 involves something your digestive system appreciates and something your brain quietly pays the price for. Position 8 concerns proton pump inhibitors. The common names include omeprazole, lansoprazole known as Prevacid, and esomeprazole labeled as Nexium. These suppress stomach acid manufacturing and are prescribed regularly for heartburn, reflux, and that burning sensation after consuming food. Individuals remain on them indefinitely, sometimes throughout their entire remaining lives, since discontinuing triggers symptom return with greater intensity. Therefore, it seems the medication is necessary for preventing disaster. Here's what the pharmacist typically omits at the register. Your stomach requires acid to extract specific nutrients from your food, particularly vitamin B12, which maintains neurological tissue integrity and brain health. Reduce stomach acid far enough and persistently, and your B12 stores gradually deplete. So do magnesium and calcium, essential minerals supporting proper neural firing and clean transmission. Deprive neurons of these substances, and you get communication failures, mental confusion, and memory problems that resemble initial stages of Alzheimer's. When the genuine source is a nutrient, your medication has been preventing absorption of this whole time. A substantial 2016 investigation published in JAMA Neurology reviewed more than 73,000 individuals 75 and above. Those consuming PP is regularly demonstrated 44% greater dementia likelihood compared to those avoiding them. The issue extends further than just nutritional deficiency, since PP is additionally elevate amyloid beta concentrations in the brain, that harmful substance accumulating throughout Alzheimer's progression. The appropriate action is this: should you take a PPI continuously, that warrants a discussion with your doctor. Many individuals can gradually transition to a milder category called H2 blockers, like famotidine, available as Pepcid, carrying substantially reduced thinking-related risks. Consuming deglycyrrhizinated licorice, a plant-derived substance supporting stomach lining health, can ease discomfort without affecting your mind whatsoever. The objective should be minimal dose for minimal duration, not a daily pill from habit alone. Position 7 involves therapy for a condition many individuals prefer keeping private. Position 7 addresses bladder control medications, specifically oxybutynin, marketed as Ditropan. Medical professionals recommend it for seniors experiencing sudden, urgent bathroom needs, the kind of overactive bladder that transforms someone's entire schedule. The comfort relief is authentic, and so is the dignity it provides. However, oxybutynin reduces acetylcholine activity, matching diphenhydramine's mechanism. This one penetrates your brain readily and positions itself precisely where memories form. That classification places it among the highest risk selections on this inventory for someone past 60, particularly with continuous applications spanning months and years. During 2019, a prominent medical publication reviewed individuals beyond 65 consuming strong anticholinergic drugs, including oxybutynin, for beyond 12 months. Their dementia probability increased 49%, approaching 1 out of 2 individuals. What concerns me most is their lack of notification. They received assurance about bladder control assistance. Nobody mentioned concurrent mental decline. The cognitive decline gets attributed to aging. Individuals report overlooking scheduled events, misplacing possessions repeatedly, losing track during everyday discourse, and others agree it's simply getting older. Rarely does anyone connect it to the prescription until substantial deterioration has transpired. When oxybutynin use accompanies notice memory problems, take that seriously because balancing bladder wellness and brain wellness isn't impossible. Contemporary alternatives, including mirabegron, marketed as Mirbatric, operate through completely distinct mechanisms without acetylcholine suppression. They generally deliver equal symptom management with substantially reduced cognitive hazard for aging adults. Bring it forward at your following medical consultation. Position 6 might shock you because it represents one of the planet's most frequently distributed medications. Position 6 concerns statins. Simvastatin and atorvastatin, marketed respectively as Zocor and Lipitor, rank among the planet's most frequently prescribed drugs, particularly for individuals past 60. They accomplish important work controlling cholesterol and decreasing heart attack and stroke danger. Statins genuinely belong in numerous people's treatment regimens, and this isn't opposing their use. What follows represents the portion of the story typically remaining unspoken. Cholesterol influences far more than cardiac function. Your brain consists of roughly 60% lipids and depends on cholesterol for synthesizing myelin, the insulation surrounding each nerve, enabling signal transmission to happen quickly and accurately. Severely lowering cholesterol through potent statin dosing can leave the brain insufficient in a material it genuinely requires. The statins producing the largest complications are those readily penetrating brain tissue. A 2023 investigation in Frontiers in Aging Neuroscience observed individuals exceeding 70 taking statins continuously for beyond 36 months demonstrated 26% elevated mild cognitive decline incidence. Greater dosages correlated with steeper deterioration. Certain individuals recounted disturbing gaps, recognizing that a familiar person's name vanished, remembering a conversation they'd completed moments before had disappeared, suddenly finding unfamiliar the way home they'd traveled 2 decades. Recognizing that various statins produce different brain consequences matters significantly. Pravastatin and rosuvastatin don't enter brain tissue as readily and generally represent safer selections for protecting thinking abilities. Should you've consumed a statin for years while experiencing increasing mental cloudiness, forgetfulness, or disorientation, that merits genuine discussion with your healthcare provider about decreasing dosage or substituting alternatives. That doesn't mean quietly abandoning a medication safeguarding your heart. Collaborate with your doctor for the appropriate strategy. Never make these shifts independently. Quick interruption. Should this be connecting dots for you, take a second and tap the thumbs up. It genuinely helps this data find additional seniors who require this knowledge. While you're there, tell me your current prescription count. I examine every comment, returning to the countdown. Position 5 involves the benzodiazepines, lorazepam marketed as Ativan, diazepam marketed as Valium, alprazolam marketed as Xanax. These count among America's most frequently distributed drugs for worry and rest issues. They operate by enhancing GABA, your brain's inherent quieting mechanism that reduces excessive nervous activation. Initially, they provide relief, panic subsides, obsessive cognition decelerates. Finally, rest becomes possible. Gradually, circumstances shift. A 2022 investigation in the British Medical Journal monitored beyond 8,000 older individuals across half a decade and discovered individuals using benzodiazepines beyond 3 months showed 51% elevated Alzheimer's development likelihood. Extended-acting varieties, including diazepam, generated increased concern because they persist throughout your system longer and accumulate in body lipids, including brain tissue. These medications generate gradual, complete brain sedation. Acquisition of new information slows. Cognitive flexibility diminishes. Many individuals describe emotional detachment as if moving through haze, no longer completely recognizing themselves. The worst aspect involves discontinuation. If benzodiazepine consumption halts abruptly, worry and sleeplessness frequently intensify dramatically, accompanied by agitation posing genuine physical danger. This creates medication dependency specifically when discontinuation poses maximum benefit. This directive matters considerably. Should you've been consuming benzodiazepines beyond several weeks, never stop suddenly because this carries actual danger. Work cooperatively with your doctor, decreasing dosage gradually across weeks or longer. Gentler substitutes exist. Buspirone, for illustration, manages worry without producing drowsiness or cognitive deterioration. Specialized talk therapy protocols designed specifically for insomnia and worry can reestablish calm without compromising thinking. Now, position 4. Position 4 involves one medication treating 3 distinct conditions while concealing one of the heaviest consequences on this inventory. Position 4 concerns amitriptyline marketed as Elevil. It represents an older antidepressant remaining broadly prescribed today for burning nerve sensations, sleep problems, and even recurring headache prevention. This adaptability explains its widespread adoption. It appears to handle everything, but fundamentally, it represents among the most aggressive anticholinergic drugs in contemporary practice. This means it intensely suppresses acetylcholine, the chemical your neurons require for mutual interaction and retaining fresh memories. It suppresses acetylcholine so powerfully that sustained application transforms memory complications from uncommon consequences to practically predictable outcomes. During 2015, a substantial investigation in JAMA Internal Medicine examined beyond 3,400 individuals, 65 and beyond. Those receiving maximum cumulative anticholinergic exposure, including amitriptyline across 10 years, demonstrated 54% increased dementia development probability. Almost nobody ever discovered this potential. They got the medication for sleep support or discomfort management, then progressively discovered vocabulary slipping away, memory becoming sparse, focus deteriorating, and simply interpreted it as aging. Minimal dosage doesn't provide protection. A modest evening quantity sustained across years can progressively damage brain function without obvious indicators until harm becomes substantial. Should you or someone dear to you take amitriptyline, that warrants prompt discussion. For burning nerve pain, duloxetine or gabapentin might deliver comparable assistance without matching anticholinergic effects. For sleep support, melatonin or minimal-dose doxepin, considerably gentler on this brain pathway, provide workable options. For psychological concerns, contemporary antidepressants like sertraline or escitalopram generate considerably improved long-term safety regarding brain protection. Position 3 represents what I instructed you to monitor because it's prescribed to countless people for something appearing perfectly harmless. Position 3 concerns paroxetine, available as Paxil. It's among the planet's most broadly given antidepressants from the SSRI category, used for psychological distress and worry. Superficially, it appears to represent current, gentler therapy substantially kinder than historical psychiatric treatments. But this frequently overlooked aspect is crucial. Paroxetine is the solitary SSRI containing substantial anticholinergic characteristics. That single trait distinguishes it from equivalent drugs, like sertraline and escitalopram, since it impacts that identical acetylcholine system every prior medication has been compromising. During 2021, a thorough analysis in Frontiers in Psychiatry examined mature individuals taking various SSRIs and discovered paroxetine consumers showed measurable short-term memory decreases, vocabulary recovery challenges, and concentration problems throughout year one. Seniors consuming paroxetine showed 30% greater probability of cognitive decline emergence relative to those using different antidepressants. Regrettably, irony accompanies this discovery. The medication's purpose involves psychological equilibrium restoration, yet duration may erode the very mental clarity intended for protection. The remedy remains uncomplicated. For aging individuals, paroxetine generally warrants prevention when substitutes remain accessible. The American Geriatric Society listed it in the Beers criteria, a standardized catalog of drugs potentially inappropriate for aging populations. Paroxetine appears specifically for these explanations. When you currently take it, consult your physician regarding transitioning to additional SSRI selections like sertraline or escitalopram, generating superior safety without equivalent thinking-related hazards. Supporting sufficient B vitamin levels, particularly B12 and B6, might also support emotional stability accompanying these transitions. Position 2 gets distributed so discreetly that numerous individuals consuming it stay unaware what drug classification they're taking. Position 2 concerns antipsychotic medications. This deeply worries me because many individuals using these drugs never knowingly agreed to antipsychotic use. The medications include quetiapine marketed as Seroquel, risperidone marketed as Risperdal, and olanzapine marketed as Zyprexa. These substances were initially created and authorized for critical psychiatric conditions, including schizophrenia and bipolar disorder. Presently, healthcare practitioners frequently give them without label approval to aging individuals experiencing sleep disruption, minor restlessness, or behavioral disruption linked to dementia. Therapeutic agents created for grave psychiatric disease are presently regularly administered in residential facilities and nursing facilities for aging individuals simply experiencing disorientation, restlessness, or behavioral challenges straining busy employee resources. The harmful effect can be considerable. During 2022, a major research publication in Lancet Healthy Longevity examined beyond 25,000 aging individuals, administered antipsychotics for behavioral complications, and discovered 71% increased probability of accelerated cognitive decline within year one, regardless of prior dementia absence. These medications additionally amplify stroke probability, sudden cardiac death likelihood, and the extreme sedation adding to slip hazards and medical hospitalizations. They operate by suppressing dopamine, a substance involved in emotional control plus focus, arranging thoughts, and recollection. Minimizing dopamine sufficiently, and the brain becomes sluggish and increasingly unresponsive. Certain individuals receiving these substances develop appearing emotionally absent, flat in emotional expression, almost disappeared while their families observe someone's identity quietly fading despite remaining physically. Should you or someone near you receive these drugs, the opening action means asking the treating physician directly, what prompted this drug? Does it genuinely need continuation, or does it mainly provide caregiver convenience? Numerous behavioral problems frequently improve absent medication entirely through organized everyday patterns, limiting background noise and excessive excitement, treating overlooked physical pain, and superior rest and illumination management. When medication becomes genuinely essential, minimal workable doses consumed as briefly as possible reduces complications. Regrettably, families frequently stay uninformed regarding these medication consequences. They observe decline they interpret as simple aging when the genuine source could be pharmaceutical. Finally, we've arrived at position 1. Position 1 isn't a specific medication and might represent the biggest overlooked factor behind every scenario I've outlined. Position 1 concerns anticholinergic polypharmacy. It's the hazard nearly nobody discusses and possibly represents the primary pharmaceutical source of dementia-like memory decline in older populations. You likely anticipated one closing villain, one ultimate harmful pill. The genuine situation contains additional nuance. The greatest hazard frequently emerges from continued gathering of numerous anticholinergic drugs consumed concurrently while absolutely nobody tallies the aggregate consequence. Polypharmacy simply indicates simultaneous consumption of numerous medications. Anticholinergic burden references the aggregate suppression of that singular memory-related chemical happening simultaneously. Consider a widespread situation. A senior consumes diphenhydramine nightly for rest, oxybutynin daily for bladder management, and amitriptyline for pain. Each medication separately might generate minimal, barely perceptible influence. Combined, however, consequences intensify and the cumulative brain stress multiplies quickly. During 2022, a major study in age and aging monitored beyond 280,000 aging individuals and discovered those demonstrating highest anticholinergic burden showed 120% elevated dementia likelihood within 10-year periods, more than doubling the probability. The overwhelming majority remained oblivious they were consuming anticholinergic drugs. Nobody previously clarified this. When acetylcholine suppression happens via multiple sources simultaneously, the mind doesn't simply decelerate. Neurons can diminish from insufficient engagement, interneuronal networks might shrink, and the brain might transition into a quiet, insufficient condition resembling Alzheimer's during mental examination. The encouraging information is what motivated this content. Medication-triggered cognitive decline frequently becomes correctable when identified initially. Minimize that combined burden, and most individuals restore intellectual capacity, stamina, and recollection across weeks or months. The mind demonstrates substantially greater durability than commonly understood, exclusively when the damage source disappears. The answer doesn't require amazement. It demands thorough medication assessment. Gather your physician or pharmacist and thoroughly examine each prescription medication, each non-prescription item, and everything else you swallow. Calculate the cumulative anticholinergic influence. Available tools help identify that hazard. Following problematic drug identification, superfluous medications can be gradually eliminated with physician oversight. Less hazardous substitutes can be incorporated and your brain gains possibility for healing. This potentially represents the most correctable aging mind danger available and exactly why it occupies the topmost position. I want hearing from you currently. Of these 9 categories, which currently remain in your bedroom or bathroom, have you encountered mental haziness or memory decline following medication initiation? Share your experience in the comments. Additionally, commit to requesting a medication assessment this current week. Your statement might deliver the specific motivation someone else requires. Prior to finishing, one more location contains your body's signals. Your medication assemblage represents one area. Your hands represent another. Your nail beds can communicate warnings regarding kidney function, circulatory well-being, even nervous system concerns years before additional symptoms manifest. Virtually nobody learns what warning indicators exist. That becomes our subsequent topic. I'll demonstrate 4 fingernail signs demanding tonight's examination. I'm Dr. William Lee, Maintain your cognitive sharpness, and I'll reconnect soon.